Hey guys, my name is Mavi, and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? One of the things I'm often questioned about is how do some girls get their waists so tiny and their behind so big? So today I brought one of the leading experts in the industry of making those big butts and those tiny waists, Dr. Andre Marshall. Hello, Dr. Marshall.
Good morning, and it's a pleasure to be back on your podcast.
Be back, one of the fan favorites. I'm super excited to have you on. And today, you're going to really educate us on something new that I know a lot of surgeons are not even doing, don't offer, don't even know how to do it. So tell us about what have you been getting yourself into this past year of 2024? The last time we talked, you weren't doing it.
So I think as far as body contouring goes, we have to acknowledge that our colleagues in South America essentially invented a lot of the things that we do today. And they're usually one, if not two or three steps ahead of us. And I think that's okay. And so, you know, I've heard about rib remodeling. I knew it was eventually coming, but I wanted to be on the forefront of this revolution. And so I actually spent about 5 days in Brazil, taking courses, learning from people that flew in from all over the world who've been doing this for several years, and learned several different techniques of this procedure. And so a lot of it is, you have to take the time to want to become better and to learn new techniques and to be humble enough to let somebody else show you how to do something. And so this isn't one of those things that you read in the back of a plastic surgery magazine or go and watch a lecture on it and all of a sudden start doing it. To me, that would be somewhat dangerous. But in this course, we actually, like I said, I spent 5 days in the operating room, patient after patient, and didactic session, learning the principles, the techniques, how to deal with complications, what to do if XYZ goes wrong. So it's something that's revolutionary, changing the face of plastic surgery slowly but surely, and definitely excited to talk about it today.
Me too. I know you have been doing this for a while. One of the things that I mentioned to you before I brought you on was I was going to talk about this last year, but the surgeon that I had lined up to come on and talk about it told me, "Hey, you know what? I don't want to talk about that because I've been having a lot of complications." So it kind of deterred me a little bit. It kind of like steered me in a different direction. I was like, hey, maybe it's not the right thing for me to talk about now. But you are somebody that I trust. And if I can hear from you that there is a safe way to do this procedure, I'm all about it. So, one of the things that has brought this procedure about is the desire for the smaller waist and that contour, that this this little contour right here as we see. Tell us a little bit about that.
Yeah, so I've been doing this procedure for about 7 months, and so I've done a lot of cases. On average, we kind of started off slow, doing maybe a couple cases a month, and now it's pretty much every week we're doing this procedure. And the more people become educated on it and see how safe that it can be, I believe the more people will endeavor upon it. Um, so basically, in the past, you may have heard of rib removal, and that really gave people a small waist, kind of gave you that I don't know, 1800s look where they wear those really tight corsets and have those like 20 18 20-inch waists. Um, I've never been a fan of that for a couple of reasons. One is anytime you're doing that much extensive work close to the lungs, there's certainly a greater risk of injury to those lungs. Number two, those scars that are left by making the incision for rib removal, they're large and they're obvious. And everything I do, I try to make it look like you haven't had obvious plastic surgery. Um, so from the safety profile and the actual scars, I've never been a fan of the rib removal. I've never practiced it, never done it, never advocated for it. There are people who still do it today in the United States, here in Los Angeles. There's people who do it in several states, and that's fine, but that's just not something I personally choose to offer. What I do is essentially a minimally invasive technique where I use a needle. It's called an 18 gauge needle, and you go through the skin and you access the rib itself. This is all done under ultrasound, so it's not done blindly, which is huge because you can see everything. You can see the lungs, you can see the ribs, you can see the muscles. I access that rib using something called a piezotome, which is the same exact instrument that rhinoplasty surgeons use to shape the bone on your nose. No difference, very atraumatic. You make a small little cut in the rib, and then you basically just kind of snap and just kind of slightly bend that rib. And that's essentially it. All you do after that is you wear a corset until that rib forms new bone in that new position that you placed it in. And once that new bone forms, you have that small waist. Typically, on average, we're seeing about a 3 to 4 inch waist reduction in patients who are good candidates.
I love to hear that. So, who is the right candidate for this procedure?
Yeah. It's the goal is not to exclude anybody from plastic surgery, but there are people who are better candidates than others. So if you have a lot of visceral fat, then you're probably not going to be a great candidate because no matter how much you bend those ribs, that visceral fat is going to push them back out. In general, once you start getting closer to a BMI of 28 to 30, your the benefits of the operation probably go down quite a bit. So I would say if someone's already had, let's say, liposuction, but they didn't, they've been maxed out on their lipo, or they've had a tummy tuck and lipo, yet they still have somewhat of a boxy frame, those are probably some of the better candidates. If you have a lot of subcutaneous fat or fat right below the skin and have never had lipo, but you want your ribs done, you're probably not a great candidate. So it's either best to do it in combination with lipo or get the lipo done first and then do this procedure. Because at the end of the day, I never want to put somebody through something that's not going to be worth their time. So if someone is not a good candidate for it, I will let them know. But I don't want you to pay or undergo a procedure that's not going to be beneficial for you. So the biggest thing that limits patients is a lot of, like I said, just visceral fat. If you've had kids and you have a lot of um, rectus diastasis or muscle separation, but you don't want a tummy tuck, but you do want your ribs done, well, all those muscles that are separated are attached to the ribs. So your maximal benefit is going to be from muscle repair plus the ribs. Because if you just have all the separated muscle and try to bring the ribs in, you're not going to see the result that you want.
So, you touched on something that we haven't really taken a deep dive into, which is visceral fat. Why don't you tell us about what it is and how patients can get rid of it?
Yeah. Yeah. Visceral fat is one of those things that we talk about, but we really don't know a lot about it. And to put it simply, is sometimes you may see somebody who walks around, especially men, with what we call a beer belly. And they may have a large protrusion of their belly, but if you were to pinch the skin, you don't really feel a lot of subcutaneous fat. And because a lot of their storage of fat is around their internal organs, it's right next to the liver, right next to the stomach, right next to the kidneys and the intestines. That is fat that cannot be removed with liposuction, only through weight loss. Um, and where or how much of that you store is completely genetic. Sometimes we'll see patients who have BMIs of 32, 33, and they all have visceral fat, but a lot of their fat can be subcutaneous. Whereas there's some patients who um, have a lower BMI and they don't have much subcutaneous fat, but then they'll have a protruding stomach, and that is the visceral fat. So, where and how much of it you keep is mostly genetic. When patients lose weight, a lot of times they will lose weight in the visceral fat, and that's why they start to see a reduction in their waist or their pant sizes may fit better. I always tell people, don't, if you know you're having surgery coming up in 2 months, don't just say, I'm going to eat whatever I want because the doctor's going to lipo it out anyway. that's poor thinking because you may gain 15 pounds, but 10 of those may end up going to the visceral fat. If that happens, then there is no way you're going to get the absolute results you would have gotten at 10, 15 pounds less because we as plastic surgeons or whoever cannot remove that visceral fat. So it's hard to say how much of it you have unless you were to do a body composition scan. A lot of times you'll know by if you just stand in the mirror and you pull your stomach in, you'll see, can you pull your stomach in flat or is there still somewhere of a protuberance there or protrusion? And that usually indicates how much visceral fat you have.
When I always see the topic of visceral fat coming up, after somebody has already had surgery, they've already had a tummy tuck and they've already had a lipo, but then they turn to the side and they're like, but look, like I still look pregnant or I still look round.
Yeah, very common. It's something that we certainly do hear and deal with a lot. Here's one foolproof way to see if you're able to achieve a flat stomach after a tummy tuck is this. If you lay down in your bed or lay down flat on your back, if your stomach protrudes above your rib cage, then a tummy tuck will not get you a flat stomach. That usually indicates that you have more visceral fat, um, that you just need to lose a little bit of weight in order to get that flat stomach. So that's reason number one. Reason number two for not having a completely flat stomach is, and this is kind of next level thinking, but some patients who have been overweight for a long amount of time have what's called hepatomegaly or a fatty enlarged liver. Your liver sits on the kind of the top right part of your abdomen and crosses over to the central part of your abdomen. And your left part of your abdomen is your stomach itself, and everything else is your intestines. You don't really ever see your diagnosis unless somebody gets a CT scan. But for people who have bad diets or who have been overweight a lot of their lives, fat starts to deposit inside their liver and makes it larger. And so some of those patients will get a tummy tuck and their lower abdomen will be really, really flat, but they'll have a bulge at the very top. And a lot of that times it is the liver, partly enlarged, that causes that. Now, is it reversible with a change in diet and weight loss? It is. So that is something that's very, very common. And it's a great topic. I'm glad you brought it up.
So, one of the things I want to touch on today is what is the recovery process for a procedure like this? For example, if somebody decides to do it at the same time as their tummy tuck, how does that recovery go?
As most people know, with tummy tuck with lipo, I always do lipo 360 with my tummy tucks. Um, the recovery for that, I tell people don't go back to work for at least 3 to 4 weeks. This is a large investment in your body, and you don't want to rush the recovery process. You really can't rush the recovery process. So, adding that on to something like a tummy tuck doesn't really change the recovery. I like to look at it as if, let's say, you've had your tummy tuck, you've had a lipo, maybe a BBL, and you just want this procedure done by itself. Where you're going to have the procedure. It's done all the way asleep under general anesthesia, no awake procedures. And you don't need any massages if you're just doing this by itself. You're going to wake up, we're going to put a corset on you, and then you're going to go home, watch, your TV shows and recover. If you are working a desk job, then I would say you're probably back to work the following week. But if you're working at an Amazon warehouse lifting boxes, you need at least a month off because you can't have, walking around with the ribs that have been altered and then lifting heavy boxes and things like that. So, no heavy lifting essentially for 4 to 6 weeks. But desk jobs and things like that, sitting at a computer, you should be fine.
Wonderful. I think most of my girls, when they are planning their recovery, they're planning their surgery, they're like, how much time do I need off? And I always tell them, usually you need between 3 to 4 weeks if you have a desk job. If you're lifting heavy or if you have a very strenuous job, I would probably plan for the full 6 weeks just to give yourself that space, because one of the things that we don't talk about that often, but is actually quite common, are small little, not complications, but little things that happen during your recovery. For example, an extended amount of swelling, or maybe your incision isn't closing as fast as we would want it to close. Or maybe tell me if you've seen this happen. they get past that 3 3 week, 4 week mark, and they're like, "Oh my god, I love it. Everything looks so good. I'm not gonna eat anymore so I don't ruin my results."
Yeah. Yeah. No, you're that's the worst, actually. That is the worst. Nutrition is, I think it's definitely something that's undervalued in plastic surgery, and especially after procedures that involve fat transfers. And with a tummy tuck scar, there's so many factors in play. When my pre-op labs, I always check nutrition labs, particularly something called albumin, because I want to see, I want to check your protein levels. Like, your body needs collagen, needs all these nutrients to recover. I get it. You just had a tummy tuck. Your muscles are tight. You're wearing a faja, maybe even a corset. So you just can't eat as much. And so you have to find a way to get these calories in. And I preach, preach, preach. I even give some people certain macronutrient goals to reach, because I don't want you to go through all of this, then lose 3 or 4 pounds, and all of a sudden your booty's gone. Or now your wound is not healing because you're not getting enough collagen in your diet and getting enough protein. So that is extremely important, 100%. But yes, I do agree that the more time you can take off of work, the better. And some people say, well, I haven't built up enough PTO. Well, keep building up PTO until you have the proper amount of time. Because plastic surgery should not be one of those things where, oh, I'm going to go get surgery. And then if it doesn't turn out the way I should, I'll just go get a revision later. We should not be thinking that way. Let's try and get this done right the first time. I'm a one and done type guy. And I will do large procedures because I don't want you to have to go through this whole process over and over again. So if we can maximize, if you want to get your breast done, your butt, your tummy, as long as we can do it safely all at once, let's do that. Take as much time as you need off of work. Whether I've had people take 6 weeks to 3 months, whatever it takes to get you back and recovering and get the body you want. That's the most ideal thing.
Absolutely. One of the reasons why you're one of my favorites is because I know you are always looking to innovate. And as you said earlier in the beginning of the episode, you went down to South America to learn from the people who have been doing this for years, if not decades. Because if you're Mexican, you've heard the rumors of Thalia and her having a rib removal procedure to get her waist so tiny. So it's something that in Latin America, we've been hearing about it for a long time. What else are you seeing coming down the pipeline?
Oh man, that's a good question. Um, there's always new techniques that are coming, and like I said, I go to a lot of meetings, and I usually hear about what's happening with the South Americans first. So there are some procedures in tummy tucks that involve something called the ultra wide plication, where they will do, let's just say in a standard tummy tuck here in America, we will tighten or repair the muscles, let's say maybe anywhere between 4 to 8 centimeters. These guys in South America and in Mexico are doing sometimes 12 plus centimeters. So sometimes they're doing twice as much as what we're doing. And that alone is causing the waist to become extra extra small, as if you're mimicking rib remodeling. So that is definitely on the forefront, something I anticipate we will see more of in the next, I would say, probably 2 years. um, as you know, Motiva now is in the United States for as far as breast implants. They're not FDA approved for buttock implants, but I anticipate at some point in the future that will become a thing. If you've ever felt or seen a patient in the United States with butt implants, they tend to be more of the hard shell silicone, not the soft ones like breast implants. So I think eventually we are going to have a silicone gel buttock implant, and that will definitely be a game changer for a lot of patients who have had BBLs that just didn't work, or just people that want more volume. So I think we'll see an increase in buttock implants in the future.
You know what I want to ask you? What is your secret sauce to making the fat stick? Because I was literally right before we started looking at a Facebook post of a woman who went and spent $50,000 to have her whole mommy makeover and BBL and everything. And she was showing her before and after photo. And like none of the fat stayed, none of the fat stuck. So, what's the secret?
I do have, I mean, I have a couple secrets. I don't want to give them all away.
Ah!
But a lot of them, some of them are or what actually happens in surgery. And but I'm gonna share what I have the patients do, which will help you guys the most. Um, you know, I will say, PRP is actually pretty nice. And just like people use PRP for a multitude of things, it actually works really well with fat transfers as well. I'll leave that out there for a different discussion. Um, so what happens? We take fat out, we put it back in. So if you were to take out someone's kidney or a heart, just like a transplant, once you take it out of their body, it's technically no longer alive. Okay. But with a heart, you put it in, you hook up the arteries and the veins, and now that heart is beating again. Same with the kidneys. But with fat, we're not hooking up little vessels. And so we put fat in, we put these large amounts of fat in, and then what happens? You essentially put dead fat back into somebody's body through the process of diffusion, where oxygen permeates through the skin and cells. Some of that fat will survive, some won't. So one mistake people make is they think that by putting more in, you're going to get more fat survive, and that's not always the case, because whatever's in the very deep center of that big globule you put in doesn't get a lot of oxygen. That's what's going to die the most. And if you ever hear about people getting fat necrosis or lumps or nodules, that's usually what's happening. So you putting in more is not always the right answer. Doing really good lipo around the butt, that is actually the best option, because I call that addition by subtraction. So by making the waist look small, it already makes the butt look really big. So that's helpful. But I don't let patients sit for 8 weeks. You may have heard some people say 3, 4, 6 weeks. I have personally found that I don't let them sit for 8 weeks. And people don't like that, but I'm getting the results I get for a reason. And you say, well, why is that? Well, I give everyone a BBL pillow, and I say, don't even use this pillow unless you absolutely have to. And the best analogy I have is, if you're standing up straight, you can feel the skin on the back of your elbow. It's nice and supple, it moves very freely. The minute you bend your elbow, that skin around your elbow becomes tight. That is what is happening when you're sitting down as well. So I find that by standing up or laying down flat, you're allowing that fat that I put in to stay exactly where I want it without any undue tension or stress on the butt. But every time you use that BBL pillow, you are causing that skin to move, and that fat often shifts. Now, if you went somewhere where they inject the fat in the muscle, that conversation does not apply. I don't inject the muscle. I'm always above the muscle, ultrasound, doing it safely. But for those who have it above the muscle, which most American surgeons do, sitting or even on a BBL pillow will affect your results to some degree. So I tell patients, avoid that pillow at all costs. Weight management and nutrition. We give you a weight goal depending on how much fat I put in and how much fat I threw away. We expect you to maintain that weight goal. If anything, it's better to gain a pound or two post-op than to lose a couple of pounds. On average, I put 2 pounds of fat in each buttock. So if you start losing weight aggressively, oh, I don't want to eat, I just had lipo, I want to stay skinny. If you come back 3 pounds below your pre-op weight, I already know those hips and part of that butt is going to be significantly diminished. So maintaining adequate nutrition, calories, protein, not sitting, those are patient keys in order to get some of the better results.
Do you have an average calorie intake for kind of threshold you want them to meet daily?
If everyone's slightly different. I have some patients who are very athletic, work out all the time, and some patients do nothing at all. I usually say, if you come in around 140 to 150 pounds, my protein goal for you is going to be somewhere about 120 to 130 grams of protein a day, with about 50 to 60 grams of fat, and then probably at least 100 grams of carbs. So that's all going to, depending on patients' activity goals and kind of where they start. We kind of modify those things. But some patients come in and they weigh 200, and then some people come in and they weigh 110 pounds. So we adjust those goals based upon where they are.
I love it. It's always such a pleasure to have you on. I want to know, what are you excited about in 2025? What new ventures do you have, or what plans do you have in 2025 that you're really excited about?
I mean, this rubber modeling thing is really taking off, and I'm really excited about the kind of the future of it. Just because, um, you know, here in America, we're always looking at other countries and saying, how do they get the results they get, and we're so close to that now. We understand so much more. And it's not that we're trying to emulate anybody, but we're trying to keep patients safe by them not having to travel thousands of miles to somewhere else where they don't speak the language. And if we can offer a lot of those great things right here in America or in California, that is very exciting for me, just to be able to offer something that, number one, not many people can do and don't know about, but also something that's very safe, and it's really revolutionizing a lot of these women's bodies and ultimately helping their self, their confidence. It's not barbaric, it's extremely safe. And the complication rate is very low when you're doing it well and trained hands. So that's probably what I'm most excited about, is just seeing this really take off. And but yeah.
Yeah, I love it. So, one of the things that is on my radar as of late is, and you are, in my opinion, a fat grafting king, um, micro or nano fat grafting to the face. Similar to, well, kind of like what they're doing in Korea with, instead of doing more like injectable or like this, more grid style fat grafting. What do you think about that?
I think it's actually, I like the concept, and that's, there's a lot of principles of fat grafting in order to get the fat to stay. I do have seen some of the patients you're talking about, and I think the results are amazing. And you see a lot of these up and coming face surgeons, and you're like, wow, how do they get the results that they get, such as like Dr. Truesdale here in Beverly Hills. Absolutely fantastic results, one of the best facial plastic surgeons I know. And if you watch some of their techniques, you'll see that they're already employing a lot of these principles and getting these really, really good results. So I love it. I mean, from the Koreans are so advanced, South Americans are so advanced. And so the more we adopt and are humble ourselves and use a lot of their techniques, the better off we'll be. Even some of the skin tightening technologies that I use are actually from South Korea. I use a device called retraction, works fantastic, made in South Korea. I was the first person in the state of California to have it, and I think maybe the second person in the USA to have it. So I'm always looking to be innovative, advanced, and take it to the next level. So can't wait to see what happens with facial fat grafting as well.
I love that. You touched on something that is actually quite popular, which is the skin tightening devices. One of the questions that I get a lot is the recovery time more when you add a skin tightening device versus not having a skin tightening device?
I would say the recovery doesn't really change all that much. So you don't need to be adding 2 to 3 days to recovery. It's basically going to be all the same. But I think it's important to realize that skin tightening devices are not a substitute for skin removal. They never will be. If you've had 4 kids, you have a lot of stretch marks, you have protruding belly button, you have loose. There's no way that skin tightening is ever going to be beneficial for you, and I won't even offer it. I think it's for people that have minimally to moderate loose skin, like your grandma's got, saggy arms, your mom has it, and you want arm lipo. It's probably a good add on just to, help contract that skin. It's not removing skin, but it's helping those skin cells shrink just enough to not have you with those super flabby arms. Um, so I think the mistake that some doctors make is they offer it to everybody because, yes, it's going to cost you more. But then if you're not going to get the result that you're hoping for, then that patient probably should not be offered that technology. So I will tell people, in a best case scenario, liposuction will cause the skin to shrink about 8% because you've seen it. People get lipo and their skin shrinks. That's really good. With skin retraction, or sorry, with tightening technologies, um, at best, you'll get up to 30% at best. Some people will get better results than others. If you have a lot of stretch marks, you're probably not going to see a huge difference, but up to 30% more skin tightening is kind of what the accepted industry standard is.
What are some of the most popular areas you see that you are using the skin tightening devices?
I see a lot in the arms, for one, the upper back when women have those duplicated bra rolls. So you lipo those areas, do skin tightening there. And so hopefully when you put a bra on after lipo, you don't still have a lot of skin hanging over. The inner thighs are very common, and the abdomen as well.
You touched on something that actually I just had a conversation about yesterday with somebody who was, does liposuction to the inner thighs create more loose skin?
Yes, it does. If there's any area that I try to talk women out of the most, it's the inner thighs. And the reason why is because women are very sensitive about wearing shorts and seeing any sort of discrepancy in in the contouring of their thighs. And a lot of times it's not necessarily that the lipo is done evenly, it's the way that skin will sag after that fat's been removed, and it makes it look really bad. So I usually say, if I'm going to lipo your stomach, I'm going to take out 85 to 90% of the fat. Same for your back, same for your arms. But if I do your inner thighs, I'm only going to touch about 30 to 50% of the fat, because I've seen patients, even my own patients and patients who have come from other surgeons, the thing that they are most dissatisfied with are their inner thighs. And if they ever do what's called saddlebag lipo, patients hate that as well. And the banana roll lipo, be very careful, because it looks good maybe now, but in 10 years, your booty's going to sag and drop and you're going to be upset. So the lateral thighs or the saddlebag, watch out. The inner thighs and the banana rolls, areas that I rarely ever touch. Just that's my 2 cents.
The banana roll. Please don't lipo your banana
Don't
roll.
do it. I won't. I won't offer it.
So the bra line, how do you decide when somebody is a good candidate enough for just skin tightening of the bra line versus actually having to have a bra line incision to remove that skin?
I would say, in general, people that have lost a significant amount of weight and they're the type that need like a circular tummy tuck, maybe even a fleur de lis, or they have the extra skin on the side of their breast needing a thoracoplasty. Those patients are just, there's no way you're gonna help fix their back without um, some sort of skin removal of the upper back. If somebody has, if you're looking at those back rolls with their arms down and they have 3 or 4 deep crevices of back rolls, no amount of lipo is going to get rid of that. No amount of skin tightening is going to get rid of that. I rarely ever perform back lifts in general. Most women don't want that scar, even if it's a nice scar in their bra line. They just, not all bras are the same, so it's impossible to hide that scar in every certain bra. A lot of times patients will come and say, I want a back lift, and I'll look and I'll assess their skin quality. They have thick dermis, not a lot of that loose, crepey skin. And I've found that with just really, really aggressive lipo and maybe additional skin tightening, you'll get that nice and smooth. And so I always say a back lift probably should be your last resort. If you're an aggressive liposuction surgeon, you should be able to make a huge difference in most people without the need for that bra line back lift. But if you've lost a lot of weight, especially over 90 to 100 pounds, you're probably looking at a scar back there.
I agree. I 100% agree with that. You know what you posted yesterday? I think we should talk about it. You said the last surgery of the year, a reverse tummy tuck.
Yeah.
Tell us about what a reverse tummy tuck is and who is even a good candidate for a reverse tummy tuck.
Yeah, it's reverse tummy tucks have been around probably since the 1970s. And so the whole goal here is not to avoid, doing a traditional tummy tuck. I always tell patients, I give them options. And I say, you've all watched the Olympics, there's a gold, silver, and a bronze medal. And so someone, you've had a couple of kids, you have muscle damage above and below, the gold medal operation for you will be the standard tummy tuck, where we're going to take a lot more skin, we're going to tighten all the muscles. The silver medal would probably be the reverse. And so who is a good candidate for the reverse? Well, the girl I just showed, she has had no kids. She's in her mid 30s, but she has had aggressive liposuction. She previously went somewhere out there in Texas. You probably know the surgeon well. And so a lot of times after you deflate the balloon, which is our skin envelope, I compare air to fat, that skin is going to sag. And it's not that much, but most girls will stand in the mirror and say, I like when my stomach looks like this. It's nice and tight, and they'll lift that skin up. And so for those patients that have ideally larger breasts where they can hide a scar under their breast, we can just go in and take a wedge of skin. We can go dissect all the way down to the belly button. We can even tighten the muscles through that. So if you just have upper abdominal skin looseness, then we can tighten those muscles. And so for patients who have the skin isolated just to the upper abdomen and they're pretty tight, or they don't have a lot of excess skin below, it's a really good option. But I prefer it in patients, number one, who are getting either a breast procedure, such as a breast lift or breast reduction, because it's the same scar, or in somebody who has larger breasts that can hide the scar. If you're a flat A cup, now you're dealing with a scar underneath here that you can obviously see. So those are patients who are good options. I have one coming up in a couple of weeks. She had a tummy tuck years ago, and then 7 years after her tummy tuck, she had a baby. She's still tight down below, but now she's just lax in her upper abdomen where she tended to carry her baby, and so she's just going to get some tightening of her upper abdomen, and that's it. So most of the patients I've done have either always, most of them had previous lipo, usually by somebody who's pretty aggressive, and they just have that little bit of laxity.
Beautiful. You know what I've never asked you, and I've had you on the show so many times, and I have never asked you about this. Um, you know what? I actually had Dr. Galanis on, and he was the one who told me that he was doing this, where he does a mini tummy tuck incision, but plicates all the way to the goes all the way to the top and does a complete muscle repair, even with that small little mini tuck incision. T- Is that something you're doing too?
Yes, yep. I've been doing that. Actually, learned that about 2 years ago from Dr. Hoyos at his course in Colombia. So, but yes, that can be done. That's actually that's a good option for people that. So you may have seen the tummy tucks with the vertical scars, and some of these patients you'll see that the vertical scar is literally right below the belly button, or it's a super long vertical scar, and you're like, well, who wants to walk around with a vertical scar that long? That just doesn't make sense. So, who is a good candidate for what I call the mini tummy tuck with full muscle repair? Well, patients who don't have a lot of excess skin, but they have obvious diastasis. Patients that have a higher belly button are the best candidates because where your belly button is supposed to be, if you were to put your hands around your hip bones and right at the very top of your hip bones, that's where your belly button should meet. Some people have a high belly button. That's perfect because you can go and lift up all the skin, tighten the muscles, and pull the belly button down just a little bit and then close all that skin. There's no vertical scars. The belly button is now in a more normal position and all the muscles are tightened. Um, Now, for people with low belly buttons, that's not a good option because you may have seen people have gotten a mini tummy tuck and now their belly button's this far from their incision, or you can't even see it at all when they're wearing a bikini. That was the wrong operation for that person. The doctor made a mistake, and now, you know, well, we'll get into that later. But nonetheless, so patients who have high belly buttons, great candidates. People who have minimally loose skin, but do have a lot of diastasis or muscle damage, those are perfect candidates. It's rare that patients are good candidates for those, but I do perform it. It's not that often, but yes, it's a good operation. But the majority of women need a full tummy tuck.
I agree. 100% agree. I have seen though with the Ozempic and the weight loss craze, more women who are just having a little bit of laxity. They still have that diastasis, but they don't it's like they don't need the full tummy tuck because they've already lost all this weight. Their skin kind of retracted. It's just that small little area right there in the front that before they really didn't have that many choices, or there wasn't as many surgeons that were as well versed in doing the smaller incision and still doing the muscle repair. Because I can tell you in my career, I've heard surgeons say, no, that's not possible. We're not doing that.
Yeah, no, it's very common. And I think people trust us as doctors, but women still have to do their own research because just there are still doctors, especially here in Los Angeles, who will tell patients you can't do liposuction with a tummy tuck. You know that's not true. I know that's not true. And for people out there to still say that and patients just say, "Oh, it's gospel because somebody with an MD or a DO behind their name said it." That to me is just it's not right. You know it's possible. There are people who say you shouldn't do a BBL with a tummy tuck. You should separate it and do two separate operations. I mean, where's this information coming from? And I get it. Every doctor is entitled to their own opinion. You were trained in a certain way, but patients have to do their research. Over 50% of the cases I do are either revisions because somebody else had something done before and they weren't happy. And I'm just saying, could this have been avoided? Like, you know, patients see a couple good photos on Instagram and they book with this doctor, but don't do enough research. Don't forget Instagram's always going to be the best of the best, best. So don't believe everything you see. And people can Photoshop. So just be careful. Like some doctors will Photoshop out their lipo scars. They put scars all over the back, all over the front, and then all of a sudden you don't see those. So you think, oh, it's not going to happen to me. And then you get to post-op and you're like, how come I have all these scars under my butt, the sides? Well, the patients online didn't have it because the doctor photoshopped. So be careful. So talk to other patients. Hey, can I see your scars or whatever? Just that's my 2 cents. But yes, do your research, ladies and men getting surgery. Um, I'll leave it at that.
Okay, and before I let you go, one of the things that I think I've asked you before, but maybe you've changed your mind. I don't know. Maybe you've changed. Uh, and I always ask my surgeons if you're team drains or no drains.
Oh, I'm all drains all the way. Yeah, we talked about it last time. I know people who do drainless, and one trick of that drainless is there'll be no drains. The incision, your tummy tuck incision is closed in the front, but then you have all the lipo holes in the back dripping fluid. So now you're putting your diaper on and putting all the little pads everywhere else. So the fluid's still draining out. You just don't have a drain in the front. So if I do a tummy tuck, you're getting 2 drains, one in the front, one in the back. I lipo very aggressively. I use 4 to 5 liters of what's called tumescent fluid, which pain medicine, epinephrine. I want all that fluid drained out. I notice people that have drains tend to recover a lot faster than people without them. Decrease your risk of seromas. I have people flying in from all over the United States, getting their drains removed back in Washington, New York, etc. I don't want those people in the ER with seromas because I was too proud to leave a drain. So I'm team drain all the way. With liposuction, I don't leave any of those bulb drains. I usually leave like what's called a Penrose and 2 of the incisions in the front and then the elbows if I do your arms. And that will help the fluid and the masseuse really get all that extra fluid out. So
I love it. That's exactly what I wanted to hear. Even with rib remodeling, does it increase the swelling at all? Is there anything different for somebody who's in recovery to look out for during the rib remodeling?
yes. So actually, when you're wearing anything that's tight, so this kind of goes back to tummy tucks in general. So when you get a tummy tuck, you're getting muscle repair. You are tightening the actual core. So actually, the blood coming from your legs, it actually takes longer for that blood to get up to your heart now, and that is why with tummy tucks, there's an increased risk of what we call blood clots. So every tummy tuck I do, they get put on a week of blood thinners or Lovenox, and they wear the high socks just to help decrease any of that swelling in their legs. With rib remodeling, you're wearing a nice tight corset. So it's basically mimicking a tummy tuck. So you're also going to get more of that swelling in your lower legs. So I have every patient wear above the knee socks. And just I tell them to be looking on the lookout. You are going to swell more in your lower extremities. And so some patients will get massages just for that purpose in order to activate their groin lymphatics and help with some of that swelling.
I love it. Beautiful. I am so thankful that you came on the show today and you told us all we needed to know about rib remodeling. If somebody wants to come see you for a little rib remodeling, how should they contact you?
Yeah, so the best way is you can either do a virtual consult at no charge. The link is in our Instagram bio, or you just give us our office a call, 424-437-3200. And you can either set up a Zoom consult or an in person consultation. There's a fee for that, but if you do book surgery, that fee does get applied to your surgery. As far as how far we're booking out, we usually say, if you want surgery, you need to book at least 8 to 10 weeks in advance. I usually, stay booked up about 2 to 3 months, unless it's a short procedure, such as a breast aug. You can usually squeeze those in, but like a full-on mommy makeover, you probably need about 3 months lead time. BBL about 2.5 months lead time in general.
Love it. So, let me tell my girls, whenever I went to ASAP's this past year, you guys should have seen the size of the billboard they had for Dr. Marshall. Full size, full size. I can't even say how many feet tall. A picture of him with the biggest grin on his face,
I still have that. They sent it to me, but yeah, I think it was about 20 feet tall. 20.
20 feet tall. So, how was it for you walking into the meeting? As I don't want to say you're a young surgeon, but you are on the younger side of the surgeon.
Yeah, no, I'm mid 40s for sure. So definitely on the younger side. It was actually, I'm very private. I don't, like you said, you don't even see my face on Instagram a lot. I'm not one of those people, talking, incessantly on every post with my face. So I'm a very private person. So I don't. It was very like First I heard about it was somebody took a picture of it and they sent it to me. And I was like, oh my God, I got to walk around with this for the next 3 days. It was actually embarrassing at first. I can't even lie. But it's definitely a great honor to be recognized by ASAPS, the leading aesthetic organization here in the United States. But yeah, that's definitely not something I knew was coming. It was just as much a surprise to me.
It was wonderful. It was nice to see some representation of the young doctors out there, the ones who are leading in the innovative procedures, especially like rib remodeling. So kudos to you to get recognized and for them to see the talent and the skills that are behind the signature BBLs.
It's a pleasure. Well, thank you so much for having me as always. And yeah, look forward to a wonderful 2025.
Absolutely. So we'll see you guys next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.